Hi, I'm Jessica. I work at the Aging and Disability Resource Center of Door County, and this presentation is called Welcome to Medicare. Welcome to Medicare is a class that we host in person at the ADRC, as well as some of our partner sites, but we've recorded today to make it convenient for you to watch from wherever you are at a time that's convenient for you. You're here taking step one today, which is starting to learn about Medicare. This is a complex insurance system. By learning, you will be more informed and prepared to take your Medicare choices to the next level. This program is supported by SHIP. The SHIP program is funded in whole or part by certain grants, as you can see here listed on this slide. Before we dig into Medicare, I'd like to give you an introduction to what is an Aging and Disability Resource Center, or ADRC. The Bureau of Aging and Disability Resources is in the Department of Health Services and coordinates ADRCs statewide. So every county has an ADRC that provides services similar to us. ADRC of Door County provides the general public a single source of information and assistance on issues that affect older people and people with disabilities. Our information and assistance is always free and always confidential. Our mission is to provide older adults and people with physical or intellectual developmental disabilities the resources they need to live with dignity and achieve maximum independence and quality of life. We really want you to know what we do before you need services from us. We have a wide range of programs. The ADRC of Door County provides people a connection point to resources. We educate about long-term care programs. We have caregiver and dementia support programs and classes. We host nutrition programs that include in-person dining, home-delivered meals, and frozen meals. And we have a large number of classes and programs that help support healthy living and wellness. This specific Welcome to Medicare class is hosted to you by our Benefit Specialist program. A benefit specialist is trained in public and private programs so we can help people in the community understand their rights and options to enroll in public programs. We receive ongoing training and are monitored by attorneys that are knowledgeable in elder law and disability rights. At the ADRC, we have both an elder benefit specialist, me, who works with people 60 and older, and a disability benefit specialist that works with people 18 through 59. As benefit specialists, we are also trained as SHIP counselors. SHIP is a national effort called the State Health Insurance Program. It gives us training so we can provide free, in-depth, and unbiased information about Medicare. When you see this logo, it means you're getting free and unbiased information about Medicare. We are not supported. We have no relationship with any insurance programs or companies. We're going to cover a lot of information about Medicare today. Everything put in this presentation helps address most of the common questions and issues that people have when understanding Medicare for the first time. So we're going to break that down into enrollment, the Medicare basics and parts, some of your coverage choices and options. We'll explain what Medicare Advantage plans are or other types of insurance you might have access to. We will talk about Medicare prescription plans and options, the open enrollment period, and help for people that have limited income and resources that might need help paying for Medicare. Pictured on this slide is the Medicare and You official handbook. This is mailed to every individual that is on Medicare each year and to people that enroll for the first time. It explains Medicare and provides a lot of helpful information about the coverage through Medicare. So Medicare is the federal health insurance program for people that are 65 and older most commonly, but it also covers people that are on Social Security disability insurance that are under 65 and people at any age that have end-stage renal disease. And the first thing you're really going to want to know is, am I required to enroll? When do I need to start that application? So let's start there. Let's figure out, how do I enroll in Medicare? So if you were to get Social Security benefits or railroad retirement benefits, you're going to automatically be enrolled in Part A and B of Medicare, and it's going to start in the month you turn 65. So that just essentially means you're not having to complete an application. You're going to be automatically enrolled in Medicare timely. If you're someone that's not on any Social Security, but you're nearing 65, once you make decisions on if you need Medicare, you will enroll in that yourself, meaning you have to complete an application. The starting point of applications for Medicare go through Social Security. So the ways to apply for it can be online on Social Security's website. By creating your own account, you can submit your application. You can also call Social Security for an appointment if you're not comfortable or don't have access to online services. And the phone numbers for those departments are listed here on this slide. It's recommended you call the Green Bay office to schedule that appointment, and the appointments that they schedule are usually done by phone. The application for Medicare is very short. It's only a handful of questions. Another way to be enrolled, if you're someone that's under 65 and on Social Security disability, you will be automatically enrolled in Medicare after you receive 24 consecutive months of your Social Security disability insurance benefit. So, if you're not automatically enrolled, you need to know when to start your application. This commonly is called your IEP, your initial enrollment period, and it's a 7-month period that surrounds your birthday month. So, this 7-month window starts 3 months before the month you turn 65, includes the month you turn 65, and lasts 3 more months after that. This is a window of time you're allowed to enroll in your Medicare if you need it and want it. It's important to note that if you were born on the first of the month, your IEP is shifted as if you were born 1 month earlier. So let's talk about examples here. If you were born on June 10th, your initial enrollment period begins March 1st. So that's 3 months prior to your June birthday. It then lasts all the way through September 30th. So that's the 3 full months after your birthday month. If you were born on June 1st, for an example, your IEP begins as if you were born in May. So your period begins in February and lasts through August. The timing of which of the months you start your application and submit it will depend or dictate what month your Medicare begins. So, for example, if you apply in months 1, 2, or 3, like the chart shows, so that's within the 3 months before you turn 65, your Medicare will begin on the first of the month that you turn 65. If you apply in the month you turn 65 or any of the following 3 months after, your Medicare will begin the month after you apply. So, understanding that should help you enroll timely to start your benefits when you need it. Some other opportunities to apply for your Medicare will be if you qualify for a special enrollment period or SEP. The most common SEP is going to be for people who delayed enrolling in Medicare because they were still working and had a qualifying work plan. Some of the others might be if you lost Medicaid coverage, if you missed the chance to enroll because of a natural disaster, if you missed the chance to sign up because you were given misinformation by an employer or health plan, if you didn't sign up because you were incarcerated, or because you volunteer and serve in a foreign country. If you qualify for one of these special enrollment periods, it allows you to join Medicare and you will not be subject to any late enrollment penalty. For everyone that didn't enroll during their initial enrollment window and don't qualify for a special enrollment period, they have to enroll during the yearly general enrollment period. This is January 1st through March 31st each year. If someone had to wait for this period, they likely might have a gap of insurance and may have a penalty. We'll discuss the penalties later on. Pretty common question and misunderstanding that people have is related to what to do with my Medicare if I'm still working and I have an insurance product through work. Many people continue to work after 65, so it's really important to be clear about these points so you can decide if you need to enroll in Medicare or delay if you have the option. You can delay enrollment into Medicare without any penalty as long as your group health plan meets these following criteria. So, You or your spouse are still currently working, meaning you're actively employed, and you're covered by a group health plan based on that job, and your employer has at least 20 or more employees. If you're disabled and on disability, the employer size needs to be 100 or more. If less than that, your employer plan would be considered a secondary insurer, and you could have penalties or issues with your coverage if you don't take Medicare. But if it does meet that criteria, you are allowed to delay Medicare if you choose to. Another part of deciding if to enroll is going to be learning more about Medicare so you can see if that coverage would be better than what you have through your job, or if your job insurance is better and you want to wait for Medicare to start later. While you're covered and working, you can enroll in Medicare at any time that you need to while you're still actively employed and covered, but you must enroll within 8 months of either you stop working or you lose that health insurance through the job. Whichever happens first starts your 8 month special enrollment window. If you miss that window, you'll have to wait for the general enrollment period to apply and could be subject to that late enrollment penalty. So if you're working when turning 65, it's really important that you check with your HR department or with your insurance plan. Ask if there's anything that's going to change about your coverage options or your coordination of benefits. You may also want to check with your spouse's insurance plan. And you can contact Social Security if you have questions about your Medicare eligibility and your requirements to enroll. If you choose to delay your Medicare, a side note and important tip for you is to make sure you plan ahead if you're going to wait for Medicare later to stop your HSA contributions timely. When you apply for Social Security later, Part A can backdate up to 6 months. So if you contribute to HSA, you're going to want to stop the contributions 6 months before joining Medicare. This is an IRS related rule. There is a penalty for having an HSA style plan and any other insurance overlap. This slide shows a sample of what the original Medicare card looks like. Sometimes people get this in the mail and they think that it's just very non-official. It does come on paper and it's not laminated. So sometimes people think that it's a fake card, but this is your original Medicare card. This card use could differ depending on the type of Medicare health plans you choose, but if you stay with original Medicare card, this is the card that you will use when obtaining health care. The ID number on this card you should protect like any other type of credit card or personal identifying number. It could be used or stolen to commit fraud. And you don't want to give this number out to marketing agents you'll likely get calls from. By giving that out, you really are giving access to some specific information, or they could use it to enroll you in plans that you weren't expecting. So individuals that remember if you're going to be automatically enrolled because you're on Social Security are going to get this in the mail about 3 months before their birthday month automatically. And the envelope that it comes in can look pretty plain. So important to know this might be coming so you can watch for it and avoid throwing it away. If you're someone that got a welcome packet because you're automatically enrolled, but maybe you're in that situation where you still have a work plan or for some reason don't want to keep Medicare, there is instructions in the booklet about how to decline or defer your Medicare. The directions tell you not to remove the card from the page that it comes attached to check a certain box and sign the card and return it. You're going to want to return it before it begins because otherwise you're agreeing to keep Part B and you will be charged the monthly premium. When you decline Medicare coverage and send this back, they're essentially assuming you just don't want Part B because that's the part of Medicare that costs us a premium. Part A is usually free for many people. So, what happens is they'll send you a new card back that has just Part A on it. So, you might want to write down your Medicare number before you return the card just in case you need hospital services before the card comes back. So now we're going to start talking about the basics of Medicare. What are the parts? What do they pay for and cost? This chart just provides you a general overview of what each part of Medicare covers. So Medicare has a lot of letters involved with it. Part A is hospital insurance, Part B is medical insurance, Part C is another name for Medicare Advantage plans, and Part D is drug coverage. We're going to cover each of these parts separately. So we're just going to dive in and start with Part A. So Part A is also known as hospital insurance. And hospital insurance covers inpatient hospital care, so you're formally admitted and in the hospital. It also covers some short term skilled nursing or nursing home care. It covers blood while inpatient, home health care, and hospice. Typically, it does not cover private duty nursing services, private rooms unless medically necessary, and some of the incidentals while in the hospital. As far as costs for Part A, usually there is no premium. About 99% of people do not pay any premium because they have enough qualifying work years through themselves or a spouse. There is a deductible. This deductible is not an annual deductible. The deductible is based on benefit periods, which last 60 days. So a benefit period begins the day that you're admitted to a hospital and ends after you haven't received inpatient care for 60 days or more in a row. So, the example, you were hospitalized, you go home, 60 days goes by, maybe 90 days, and you're hospitalized again. The deductible period resets and you have another deductible responsibility. Part A also has copays for individuals that might be in hospital or skilled nursing care for longer periods of time. For home health and hospice, there are no copays charged to beneficiaries. Out of pocket maximums mean like how much per year maybe could all of my Medicare costs grow to be. And original Medicare, it's important for you to know, does not have an out of pocket limit. There are other policies you can purchase to add into your Medicare package to help protect you from that, which we'll cover later. So, as far as the co-pays we were talking about on the previous slide, for someone on Part A or in an inpatient hospital stay, the first 60 days are included as part of that deductible. So, $1,676. However, if you're hospitalized for long periods of time, there also can be daily copay rates or coinsurance costs. Days 61 through 90, you would pay $419 a day on top of your deductible, and then Medicare would pay everything additional. Days 91 through 150, it would be an $838 per day cost. For skilled nursing facility stays, the first 20 days following a 3 night hospitalization are still included in the deductible. Days 21 through 100 would cost you $209.50 a day. Medicare does not cover anything beyond 100 days, so that might be a situation where you might need to consider other insurance, like long term care insurance and sometimes state Medicaid. Your status makes a difference on which part of Medicare is going to be billed while you're in the hospital. So, this slide talks about inpatient versus outpatient. This hospital status really is a complex medical decision based on your doctor's judgment, and they're, deciding whether or not you're going to need medically necessary hospital care for a series of days or not. So, inpatient happens when you're formally admitted with a doctor's order. Outpatient is just an observation status, so there's no formal doctor order that you're going to need inpatient. And this decision by your doctor kind of drives which part of Medicare is billed for your stay, driving what your out of pocket costs actually will be. All people with Part A are covered for inpatient when the doctor makes that official order that you're likely going to need 2 or more midnights of medically necessary care. You're needing care that can only be given in a hospital setting. You will know your status because the facility is supposed to give you notice if you're just going to be someone in outpatient notice or outpatient care. You're supposed to be given what's called a MOON, a Medicare outpatient observation notice, letting you know that you're there as an outpatient status. You can also ask the staff. If you're not sure and you don't think that you've been given proper notices, you should ask the staff what your status is there. And obviously, while you're in the hospital, you might not be thinking of this, but it really makes a difference on what your out of pocket costs might end up being. Your status also can make a difference whether or not you're maybe needing to go to skilled rehab after a hospital stay. Your status could really decide whether or not your Medicare will cover that stay. So all of these decisions are kind of have a lot of important repercussions after. All right, so moving on to Medicare Part B. This is also called medical insurance. Medicare Part B covers pretty much everything else besides inpatient care. So, medically necessary doctor services, specialist visits, outpatient medical care or surgeries, labs and x rays, durable equipment, diabetic testing supplies, preventative services like flu shots and wellness visits, and home health care. In 2025, the cost for Part B, there is a standard premium, which is $185. It can be higher if you have higher income, which we'll talk about in a little bit. This premium is usually deducted right off of your Social Security if you're on Social Security benefits. If not, you'll get a quarterly statement with also options to set up monthly payments with auto draft. Part B has a small yearly deductible. This year is $257. And the coinsurance is that you will pay generally about 20% of most covered services after Medicare covers the other 80. Again, there's no out-of-pocket limit on what that coinsurance cost can be, so we need to make plans for that. Another thing that would make a difference on what your coinsurance costs might be will be if your provider accepts assignment or not. So, original Medicare really doesn't have a network, but your costs can vary on whether the provider accepts assignment, which is basically agreeing to take the Medicare rate and not charge you any excess. Part B, it's really important that we talk about like when to enroll and understanding how to apply and when, because if you miss that chance, you could incur what they call a late enrollment penalty. So if you didn't enroll in Part B timely and didn't have other qualifying insurance, the penalty is 10% for every 12-month period you could have had Part B but didn't take it. And that penalty is added on top of whatever the current standard premium is, and you will pay it lifelong. So, example, if you waited 2 years, that's 24 months, so two 12-month periods. You didn't take Part B and you should have, and you don't have a special enrollment period. You will pay 20% late enrollment period on top of the Part B premium. So the 185 plus $37, which is 27 or 20%, your new premium will be $222 for your Part B premium. And this changes each year. Some people may also pay more than the standard if they have higher income. So, since about 2007, people with Medicare and who have higher incomes will pay additional cost. They call this IRMA, an income related monthly adjustment amount. So, Social Security, when you enroll, they're taking a look at what your income was from 2 years prior to set what your Medicare premium will be. So this chart shows like for 2025, they're looking at 2023 income based on what the IRS has on file for you to decide which of these premiums you pay. So individual filers with 106,000 or less of income will just pay the standard amount. Joint filers 212,000 or less pay the standard amount. Anyone above that is going to pay an additional cost. So those are all laid out here for you. But what if something's changed? What if 2023 income isn't relevant to what I have in 2025? When you are notified of what your premium is, they'll send you a letter. They also tell you if you're someone subject to IRMA, but you've had some of these changes, you can report it to Social Security and they'll take a look at adjusting your premium. So some of them circumstances might be that maybe you stopped work. Maybe that income is not relevant because you left your job. Marital status changes. maybe passing of a spouse, loss of a pension, or loss of income producing property. If any of those apply, you would report to Social Security and say, "This was my situation, this changed." They may ask you to provide some proof to show that it did change, and then they can adjust your premium. Otherwise, you kind of have to wait for the new tax years to flow through the IRS for adjustments to be made each year to year. Medicare Part B also covers a lot of preventative services, and these services are covered at no cost to people on Medicare. So, pretty common that certain exams and labs and vaccines are considered preventative services. In the Medicare and You Handbook or by going to Medicare.gov, you can search for a list of what Medicare considers preventative services. And in the book, there's a little apple symbol to each thing that's considered preventative. So if your doctor decides that one of those preventative services are relevant to you and you have them taken care of, there'd be no copayment to you. One preventative visit that you might do in your first year of being on Medicare is called a Welcome to Medicare visit. So, this kind of replaces what we would call a physical if you're on a group health plan now. The Medicare visit, Welcome to Medicare, is done within your first year of being on Medicare. And you might want to make sure that when scheduling this for the first time while you're on Medicare, you tell your office that you're on Medicare now so they can book this appointment the right way. It generally just includes some general vitals, taking some information about what kinds of screenings and vaccines you might need. Anything beyond the things on this slide that might need to be done could in turn cost you something out of pocket. And then any years following your first year on Medicare, they call it a yearly wellness visit. So this again just kind of is a check-in with the doctor. It covers the things listed here on this slide. Again, just wanting to make sure we don't call it a physical if you're with original Medicare, you call it your wellness visit. And anything above and beyond the things listed here, you may need to pay the full price if you book it as a physical. So we just kind of just talked about parts A and B, which are just the basic pieces of original Medicare. So we're going to talk more about what your coverage choices are. And essentially, when you join Medicare, you have two options. You have the option to stay with original Medicare or the Medicare Advantage plans. So they all have different parts and they work quite a bit different. So we want to break that down so that when you're making that decision of, well, which version do I want, maybe you can understand how they would operate a bit better and make that individual choice of what's going to work best for you. So we're going to start with original Medicare. So original Medicare includes those parts A, hospital, and B that we've already covered. It is the federal version of Medicare, and it works well across the country. So there essentially kind of really is no network. You have your choice of doctors, hospitals, and providers as long as they accept Medicare. Your costs can be affected by whether or not they accept assignment, which is that agreement that they are going to be paid directly by Medicare and not pass any excess to you. Um, but to it, you might need to add more. So we need to figure out prescription coverage. With Medicare, it might be a Part D plan. And we might want to buy a Medigap supplement, which we'll cover separately here too. And that essentially kind of makes this full Medicare package, original Medicare. Original Medicare doesn't cover everything. So there are some things listed here that we probably will need as we get older and we age and they start to decline. So if not covered by Medicare, you need to be aware so you can make plans to either get other insurance products or at least understand what you might be paying out of pocket if it's not covered by Medicare. So things that aren't covered by original Medicare would be preventative dental care or dentures, cosmetic surgery, healthcare outside the United States, hearing exams and aids, long-term care. So this would be those, 100, past 100 days in a skilled nursing facility would not be covered by Medicare. It also doesn't cover care if you're living in an assisted living setting. It also doesn't cover most routine foot care or foot devices, eye care or glasses, or physicals. With original Medicare, you can buy additional insurance called the Medicare Supplement or Medigap insurance. And what that does is it's meant to help partner with your Medicare to cover some of the costs that are passed on to you. So, to have a Medicare supplement, which is a private insurance plan that's designed to partner with Original Medicare, you must have your Parts A and B in place. And essentially, you'll pay an upfront premium for this type of plan. And in return, they're going to help pay some of the healthcare costs Medicare would have passed on to you, like your coinsurance costs. The costs for these plans really vary, depending on company or optional benefits that you're selecting. It might vary based on the age you are at the time you buy the policy and where you live. Medicare supplements don't cover prescription drug coverage, and they really don't need to be reviewed much year to year because the benefits under a supplement are mandated and standardized state by state. So they don't really change a lot as far as what they cover year to year. There are a lot of different policy types. In Wisconsin, we have traditional policies. Those are kind of broken down between attained age premiums. So these are premiums that will change and increase as your age increases. They become more expensive. Issue age premiums are more set at the time of the age you are when you buy the policy, and they don't inflate as much based on age anyway. There are cost sharing policies. So these kind of require you pay a portion and then they pay a portion. There are high deductible supplements. So you must pay a certain amount out of pocket before they start to cover. And Medicare select policies. So these are policies that do kind of offer the same coverage, but with a network included. So in Wisconsin, Medigap policies are different from most of the rest of the country. All but two other states offer kind of standardized Medigap plans, and they're kind of identified by different letters. And all that means is they've got a basic plan with a different variety of riders, and then they're lettered, and that's what they offer. In Wisconsin, you kind of have this basic package with the benefits listed here on the slide, and then you add which riders you want to it. So you're kind of creating your own like a la carte version instead of standardized plans. Um, so for Medigap in Wisconsin, our policies are overseen by the Commissioner of Insurance, and they're standardized. Every company needs to cover the Part B, the 20% coinsurance, Part A coinsurance costs, so those daily costs that you pay if you're in the hospital or skilled care for long periods of time, additional inpatient psychiatric days, blood and home health care visits, and outpatient mental health, additional days and coverage for that. Wisconsin also mandates that they cover some chiropractic services, and 30 days of non-Medicare skilled nursing facility days. So no prior hospitalization required, but still has to meet certain policy standards to have that paid for. And then you add additional riders based on what you need. So there are Part A deductible riders. So the Part A deductible, that $1,676 deductible that could happen more than once per year. Part B deductible is not available to anyone that wasn't eligible for Medicare before 2020. Anybody on after that is not eligible to buy that deductible rider. Part B copay coinsurance riders just helps reduce your premiums. Part B excess charges. So for those providers that don't accept assignment and could pass excess to you, that rider helps pay for that. You can get a rider that offers coverage for additional home health and for foreign travel. So, in buying a policy, if this is the version of Medicare you're looking into and you want to buy a Medigap plan, you can, decide which riders you really want. Reach out to companies that sell Medigap policies in the state. You could work with a health insurance agent to do some of that research for you. Maybe working with a few because it's likely that not every insurance agent will sell every policy for every company that's offered in the state. And then go ahead and buy that policy during your enrollment windows. With the state commissioner overseeing these policies, they do have a supplement list, so the list of companies and phone numbers. So you can go to their website at wisconsinoci.gov and find that list there. We can provide it to you here from the ADRC too if you need it. You can get in touch. When to buy this Medigap policy? So the best time to get one is going to be right away when you're brand new to Medicare and you're in this Medicare Medigap open enrollment period. This is going to start when you are both 65 or older and you're new to Part B. So once your Part B begins, you have this 6-month protected window where you can buy a Medigap policy regardless of health issues. Outside of this period, there are a couple other situations that you'll be protected, but outside of that, you could buy a policy at any time as long as the company is willing to sell you one. This includes medical underwriting. So if you have some prior existing conditions, it can make it more difficult to get a Medigap policy outside of these protected windows. Some other times that you might, delay your Medicare because you have like maybe the group health plan situation and you want to wait for later. So this slide just kind of reiterates that your Medigap open enrollment period kind of aligns with the fact that you are brand new to Part B. So your open enrollment window moves with you until your Part B begins. You can also, if you're on Medicare because of a disability, get a Medigap policy, but you get a second window when you're turning 65 to kind of reshop for those plans, which you'll really want to do because they're can be pretty expensive before 65, but then once you hit 65, the costs for the premiums can go down. Other times you can't be declined a Medigap policy is if you meet one of these criteria. So they call this your guaranteed issue rights. It just means that the policy can't decline selling you a plan based on your health if you meet one of these situations. So if you're in a Medicare Advantage plan, but it terminates, so it doesn't renew, it's not going to be offered anymore, it would give you a time that you could go move back to original Medicare and get a supplement. If you move outside the service area, so that means you're moving to a new state, then you can take a look at the state plans that they have available wherever you're moving and see which version might be better. If your employer health plan ends and or increases its costs by more than 25% in a year, or you're in a trial period of a Medicare Advantage plan. So that means maybe you tried a Medicare Advantage plan for the first time. You're within the first year of it, and you decide you want to get a Medigap plan. You're in that trial window and allowed to do that change. If you have questions about Medigap policies, there's a lot of help out there for you. So Wisconsin has a Medigap helpline that can give advice about a lot of different insurance, but specifically Medigap policies. You can contact the Commissioner of Insurance. You can also call 1-800-Medicare or visit the federalmedicare.gov website, and there are ways to research information about Medigap policies state by state. SHIP counselors can give you really generic information and quotes about supplements. Because we're required to stay unbiased, we can't really promote one company over another or tell you which ones we think are good, but we can at least give you kind of a jumping off point as far as what Medigap policies are available in the state. We can give you really generic quotes about what companies offer at what price, so to help you reach out to some of those on your own. And again, you can also work with a local health insurance agent that you trust that can help do some of that research for you. All right, moving on to Part D. So Part D equals drug. This is prescription insurance. Medicare Part D prescription insurance, you will have or can have under either original Medicare or as part of the Medicare Advantage plan. You'll want to take a Part D plan unless you have access to some other type of creditable drug coverage. Creditable just means it meets the same standards as Medicare would have, and you can use it instead of having a Medicare drug plan. Medicare Part D plans are prescription plans run by private companies that have contracts with Medicare. And again, they can be provided as part of your original Medicare package or included as part of your Medicare Advantage package. Medicare.gov, again, has a really handy tool. We call it a plan finder, where you can do comparisons of all the drug plan options that are out there. It helps you see what plans are available. You can put information about yourself, specifics about medications you need covered, pharmacies you want to use, and it lists plan by plan an estimate of what you'd expect to pay under each of them and gives you information about their costs and everything. So that's a very handy tool if you're comfortable online. or you can call Medicare for advice and they can help you enroll by phone. Medicare.gov and 1-800 Medicare is a us 24/7. So Part D is going to cover prescription medications, things that your provider finds that you need medically. It also is, needs to be on the formulary. Every plan has a different listing of drugs that they cover, so that's their formulary. The law does exclude certain medications from being covered under Part D. You must be using the medication for its medically prescribed use. Medicare Part D also covers insulin and the supplies needed to administer it. And as of 2023, it also covers certain vaccines that are given at a pharmacy setting, common ones being the Tdap and shingles. So Medicare Part D doesn't cover everything either. So there are certain medications that maybe aren't approved by the FDA. Those can't be covered by a Part D plan. Vitamins, minerals, cough medicines, ED medications, drugs for taken for like cosmetic purposes won't be covered by a drug plan. Non-prescription over-the-counters are not covered by Part D plans, but they also must be on the formulary of the plan that you're on to be covered. When to enroll in a Part D plan. So, Part D, you can enroll in a variety of different times as well. Most commonly, people are doing that during the same period we talked about earlier for Part B, which is your initial enrollment period. You'll be getting everything together at the same time when you're brand new to Medicare at 65, or changes during the annual open enrollment period. So, every fall, October 15th through December 7th, I encourage every single person on Medicare to do a plan checkup. Because these plans can change, you want to make sure that you're still in a plan that covers you well for the following year. Medicare Advantage members, so people already on a Medicare Advantage plan, can also have this second window, January 1st through March 31st, to make plan changes. Or if you qualify for a special enrollment period, you can change which kind of Medicare plan you're on or enroll for the first time if you're qualifying under certain circumstances. Costs for Part D plans vary by company. They will vary and change annually. Part D plans in Wisconsin, there are 16 plans that cover the whole state for 2025, and their premiums month to month range from everywhere from $0 a month to $130 a month for Door County. The national average is $36.78. The limit on what a deductible can be for a Part D plan is set by Medicare. This year is $590, so that just means a plan can't charge a deductible more than that. And their co-pays and co-insurance rates vary plan to plan. Um, for Part D, if you were someone that you found earlier might be subject to the IRMA, Part D also would be subject to the IRMA. So again, individuals filing with $106,000 or less, no worries. Couples 212,000 or less, no worries. Anyone above that likely will also get a letter saying you owe an IRMA fee for your Part D plan. So that will be charged on top of whatever the drug plan premium is that you pick. Late enrollment penalties apply for Part D as well. So, if you're someone that's not taking any medications, you still need some type of creditable drug coverage in place to avoid this penalty. For someone that doesn't have that, they would be charged a 1% of what that average national monthly premium is for every single month they delayed enrollment into a drug plan. And this penalty, again, is added on top of the monthly premium when you do join a Part D plan and you get a letter from the plan saying, you are subject to a late enrollment penalty because you didn't have any coverage. It will give you options that if maybe there was a mistake, you can report that and have it fixed. But the example here says, let's say you went 20 whole months before you joined a Medicare drug plan. You had no other prescription coverage. You're going to pay a penalty of what calculates out to be $7.40. So 36.78, which is the national average of the premium, times 20%. They always round it, so it's $7.40 in addition to your plan's monthly premium. And again, this late enrollment penalty is lifelong. So creditable coverage is really important. Even if you're not taking medications, you need to have something in place when you're Medicare eligible. Other prescription drug coverage that could be considered creditable would be VA coverage, senior care, which is a Wisconsin state pharmacy program, and some types of employer coverage. Whether it's retiree or active employment, you just want to make sure you check with your employer if you don't know if it is creditable. So Part D plans kind of work in phases as far as what your coverage is. Initially, you're going to pay, if there is a deductible for your plan, you're going to pay a retail rate for the prescriptions until you meet that deductible. And then you'll pay whatever the assigned co-payment rates are for the medications up to $2,000. Once you reach $2,000 of out-of-pocket costs, you're in this catastrophic period, which means you won't pay anything for covered prescriptions for the remainder of the year. So this $2,000 limit went into place in 2025. It used to be much higher. So just knowing this can change year to year as well. An opportunity to help people kind of spread out their prescription costs new in 2025 was this Medicare prescription payment plan. This is something optional. If you're someone that's projected to kind of meet that high $2,000 for the year or have maybe a deductible at the start of the year, you could choose to enroll in this to help spread your prescription costs over the calendar year. So it's not saving you any money, it's just spreading out your payments. So when you enroll, if you enroll in that, you enroll in it with your plan. And then you get, instead of a bill when you go to the pharmacy counter, your plan sends you a monthly statement letting you know what your adjusted average monthly payment needs to be. And you pay that to your plan. So this again is just an optional benefit just to help people with affordability. Okay, so we just covered the original Medicare package. So that was the Part A, Part B, the optional supplements, and Part D or prescription coverage. So we're going to switch gears to the other version of Medicare, which is called Medicare Advantage Plans or Part C. Part C kind of bundles everything together. So Part C plans or Advantage plans include your A, B, and D all in one plan. These are offered by private insurers that have contracts with Medicare to provide your Medicare coverage. We'll kind of talk the key differences, but the major one is the fact that these are network based. You must use your plan's network to get your coverage. And in 2025, there are 41 different Advantage plans that cover Door County. So the Advantage plans is pretty common that the insurers that offer these Medicare Advantage plans have multiple different kinds of plans. So one company could have 5 or 6 different plans, and they might have different networks to them. So HMOs or health maintenance organizations, now these are plans that have a specific network, and you need to use that network in order to have your coverage, your services paid for. If you go outside of the network, you may be charged full price. Then there's preferred provider organizations or PPOs. So these traditionally have a network of doctors, but with their plan allows you to go out of network. But usually you'll pay a higher cost for that, but at least gives you some flexibility. And then there's private fee for service plans. These usually allow you to go to any Medicare approved doctor or hospital that accepts the plan's payment terms. You can see those providers and get your treatment. And then we have special needs plans. These types of plans are designed to kind of provide specialty care for people, majority that are also on Medicaid or in a facility like a nursing home or have certain chronic and disabling conditions. And then the last style is Medicare medical savings accounts. These kind of are high deductible type plans that have a bank account specifically attached to provide you a small fund, and then you kind of use that to pay for the healthcare services you need. So important to know that if you join a Medicare Advantage plan, you still have all the same rights and protections that you would under the federal health Medicare version, but you must follow the plan's rules on how you get the services, such as do I need referrals to go see specialists, or are there prior authorization requirements before I'm going to get the medical services I want? And then also the networks. These rules can change each year, so we always have to stay on top of that when we're on an Advantage plan. You can also choose a plan that has the Part D included. So if you need prescription coverage because you don't have other options, many of the Advantage plans have that all in one. Um, with a Advantage plan, they can't really charge you more than what original Medicare would have charged you for certain services, most commonly chemotherapy and dialysis, and skilled nursing facility care. But each Advantage plan will have a different list of benefits, different cost sharing, and different networks. And we'll see a lot in marketing that Advantage plans maybe offer benefits not covered by original Medicare. The most popular being, some type of limited coverage for things like vision and dental. With an Advantage plan, you can't also get a Medigap supplement policy. So that means you're not allowed to. It's illegal for a Medigap policy to sell to you if they know you're on an Advantage plan. That means that you can't have another insurance package to help you pay your copays and your coinsurance. You have to pay whatever the Advantage plan list of services and costs are. So your obligations will remain with you, not another insurance plan. So costs for Advantage plans in 2025, you still will always pay that standard Part B premium. Regardless of what version of Medicare you're on, you will always still pay that 185. And then Advantage plans can set their own additional premiums. Majority of Advantage plans don't charge anything on top of that. So your monthly premium might just be the 185. But again, there's a wide range of plans. In Door County, we have plans that are on zero all the way up to $247 a month. And then they all have their own set of deductibles, coinsurance, and copayments rate. And these differ from original Medicare. So they've got a list of, for primary doctors, it costs me this copay, for specialists, this copay, for an ambulance ride, this copay. So it's all laid out what you would expect to pay depending on what services you need. And they do set out of pocket limits. So, this is another key difference from original Medicare that does not set one. Advantage plans do set a maximum of what your out of pocket coinsurance costs can be. So, if you reach it, then you're not responsible for any further costs as long as they're medically necessary care. And in Door County, those range from on the lower end, $2,000 up to what could be over $9,000. So this is another part you really have to look at when choosing an Advantage plan. There's pros and cons of each version of Medicare. So we kind of put here a list of some of the most common advantages and disadvantages of Advantage plans. Some pros, people might like that it has a lower month-to-month premium, meaning if you look at what a Medigap policy would cost, this version of Medicare month-to-month might seem more affordable. They might offer to help coordinate care between your physicians. Another benefit people will like that they offer extra benefits beyond what original Medicare can provide, things like the limited vision, dental, and hearing. And that there's a lot of variety. So that could be a pro or a con. There are a lot of plans available to hopefully help you find one that fits your needs. And they do set an out of pocket limit on what your spending could be. On the disadvantages side, you could end up paying more out of pocket with an Advantage plan than you expect. If you pick a plan that has a higher out of pocket limit, because maybe they offer different benefits you want, but that could be something you're on the hook for then. So if you pick a plan that has a $9,000 out of pocket limit, you likely will have far outspent what you would have if you went with original Medicare and a supplement even. So costs can be higher. There's no state mandates or protections for the extras. So the things like the vision, dental, hearing, fitness benefits, there's no state mandates or protections regarding those. A con could be that you do have to check these out every year because everything about their plan formularies and networks and costs can change each year. And another con is that you're kind of limited in enrolling into these plans at specific times, open enrollment windows and periods. Another key thing with an Advantage plan is when you lock into one, you need to know that even if the network of doctors changes mid-year, which they can, that doesn't give you a right to change the plan. So it could cause you some changes in your networking and having to pick new providers. Okay, so just remember there are two different ways to get your prescription coverage: standalone as part of your original Medicare package, or here under the Advantage plan as part of that bundle. But in the state, you'll see in the middle that little blue bubble. We also have Senior Care, which is a state pharmacy program that we'll also discuss a little bit later here in the presentation. That can be added in place of or alongside of a Part D plan. In addition to Medicare, there might be other types of health insurance that you have available to you. So if you have any of the options listed here on the slide, your job has become even a little bit more tricky. You have more things to consider. Employer plans or retiree group health plans, federal or state employees with packages available after employment ends. Some of them might offer plans that you can use in place of some of the Part D and Advantage plans we just discussed. You're going to want to work with your employer or union or whoever manages those insurance packages for information about how that will work in place of or alongside of Medicare. If you're a veteran, military coverage like the VA, Champ VA, or TRICARE, there's some special things to learn about that. You might want to work with your veteran service officer to learn more about how the coverage works, whether you not choose that in combination or alongside of Medicare. And then people with low income and resources may also be able to enroll in Medicaid. And there are other programs to help them fund Medicare. So these again are benefits that SHIP counselors and benefit specialists can help people really try and navigate and understand. So another option that I just talked about was senior care. So senior care is what we call a state pharmaceutical assistance program. This is a drug assistance program specific to Wisconsin. So it's called Wisconsin Senior Care. It's available to individuals who live in Wisconsin, who are primary residents in the state, and that are 65 or older, and are U.S. citizens or have a qualifying immigration status. There's a $30 a year annual fee, so no month-to-month premium to enroll in that. And you can apply for it at any time. There's no open enrollment window. You can apply at any time that you want to. So this sometimes is a backup if you're someone that missed enrolling timely in a Part D plan and you need to get something for prescription coverage. This is also a good thing to know about. But what your costs are based on income. So there's different income tiers to this program. The people in tier 1 have no deductible and they're paying $5 copays for generics or $15 for brand names. Above levels from that have deductibles or possibly spend down periods where they have to spend a certain amount out of pocket before the senior care program can kick in. But you can use this by itself or in addition to a Part D plan. They coordinate together. So this program we like to explore for people that are either really low income and need some extra help making the prescriptions for most of the time for more brand name drugs that are more expensive on a Part D plan. Maybe senior care could be a good option. Or people with maybe higher income that just need something in place for prescription coverage. It's got different helpful techniques for different people. So this is again something as a benefits specialist we help people pursue and figure out. Open enrollment. So as a benefits specialist and SHIP counselor, I will tell every single person that's on Medicare not to skip open enrollment. This is a really important time for you to take a look at the drug plans and Part C plans that are available year to year because everything about them can change. Remember, they're formularies, so which drugs are they covering, their pharmacy networking, premiums, cost shares, all of that can change year to year. So taking the time to figure out, is my plan changing something that's going to affect me during this window instead of, just assuming it's all going to be good and just keep where you're at, that can be really harmful. You might be in a plan that doesn't cover something you need, and now you would be stuck in it for the whole following year unless you can come up with some type of special enrollment period you're eligible for. So take the time. Open enrollment is every fall from October 15th through December 7th. Take a quick peek at what the plans are. Your plans that you're on already will send you an annual notice of change, giving you a little bit of announcement about what they might be changing for the following year. Sometimes you get a letter saying this plan's not going to continue next year. You need to do something. So make sure you're doing that plan. The ADRC does offer open enrollment counseling to help people with this process. You could also work with a health insurance agent. You can call Medicare or do it yourself on Medicare.gov as well. So either way, there's lots of help available for you. There's no worrying by yourself. You can contact SHIP counselors. You can call Medicare. You can call an insurance agent. If you're comfortable online, Medicare.gov has all the information, and that's what we use as benefit specialists to help people explore plans. So getting familiar with that site is really helpful. The Wisconsin Medigap Helpline is part of the SHIP network. So if you're, not available to come into the office or maybe don't live close by, you can also use that line to help you from home. As mentioned, Medicare.gov. So this is a tool that is available to anyone, and it's fairly user-friendly. Even for a government website, people will find it pretty user-friendly. In here, you can enter specific information about yourself. Once you have your Medicare number, you can create an account as well. But anybody can use it to take a look at all the plans that are available based on your residence area. So that's why they ask you for your zip code, because plans can only serve certain demographic areas. You can put information about every medication that you're taking, the dosage, the quantity you need at a time, and which pharmacies you're considering using. And it will give you a estimate plan by plan of what you might be needing to pay out of pocket based on which plan you choose. And it sorts them by cost. So it really helps take a lot of the guesswork out of who's going to cover what I need and which one covers it at the best price. Oops. So we do want to acknowledge that Medicare, I think it's kind of can be a myth that people assume that it's a low cost or free. Affording it can be a challenge. So there are programs out there that can help people that have limited income and assets. Briefly on this slide, we mentioned some of them. The Medicare Savings Program is a Medicaid-related benefit that can help people pay their Part B premium. So if eligible, it's covering that $185 a month for them. It can also sometimes cover all the coinsurance costs, so it's really helping keep out-of-pocket medical costs and access to medical care really affordable. The Extra Help Program or Low Income Subsidy is a program that's managed by Social Security. This program helps with the Part D, the drug coverage part of Medicare, and people eligible can make sure they're getting really low or no cost premiums for their drug coverage. And then copays based on their income can be limited to nothing, up to maybe $11 or $12 per prescription. And then the Wisconsin Senior Care, as I mentioned, sometimes that can help lower people's out-of-pocket costs for prescriptions as well. These programs are things that as benefit specialists, we spend a great deal of time trying to make sure people are aware of them. It's been said that, there are millions of people out there that are eligible that's not enrolled, whether they don't know about it or have had trouble getting into it. That's what we're here for, to help. This slide kind of just goes over some of the income limits and asset limits for some of these programs. If you're even close, I recommend reaching out or applying for these benefits. You won't know if you don't try. But the Medicare Savings Program for an individual, the income limit for this year, which these limits are set by the federal poverty levels, Income limit for a one person is $1,760 a month. For a couple, 2,379. So, big group that maybe are just living off of Social Security alone might be people to target for this program. And assets, we're talking about, your home is exempt from this limit as well as one vehicle majority of the time. But everything else that's kind of like cash holding or could be cashed in or has a cash value is what kind of in general what we look at when we're talking about these limits. So a single person, 9,660 of available assets, or a couple, 14,470 for that Medicare savings program. It is managed by our state Medicaid agencies. Extra help, those limits there, if your income, so these income and asset limits are a little bit higher than the first program. If you're a single person, 1,956.26 a month income. So if you have income less than that, we want to apply. And assets, $16,100 available. So, and then with Sons and Senior Care, we talked about already. But anybody in this neighborhood, I would encourage to pursue an application. Um, and one of the last things we want to talk about is fraud. So Medicare is not exempt from fraud, and the Wisconsin Senior Medicare Patrol is an agency, and that is their whole mission is to help people prevent and detect and report healthcare fraud. They really want to help preserve the integrity of Medicare and Medicaid programs. And it's realized that, there's a lot of federal dollars that are lost due to healthcare fraud and errors, just plain errors and sometimes abuse of the program. So the Senior Medicare Patrol wants beneficiaries to make sure they're protecting their personal identity and reporting errors, and making sure that they're not being subject because of like illegal marketing or challenges. So they really recommend you protect yourself. Don't give out that Medicare number to anyone except for maybe your doctors, or the insurance companies you want to have a relationship with. Treat it like a credit card. Make sure you're watching your notices and reporting things that seem to set off that something seems wrong. You gotta follow through on that. And then be cautious of free offers. If it sounds too good to be true, it probably is here as well. Um, Step two, detect Medicare fraud. So you will get Medicare summary notices or EOB type statements from your insurance plans when you're in Medicare, just like any other insurance. And these are going to show you, what was billed to Medicare, what did Medicare cover, and what might be your share. That is your first line of knowing, this doesn't seem like something I did. Maybe I better call my provider's office. I didn't have that doctor visit or I didn't get those supplies. So make sure you're looking at those. This is kind of a little brief example of what they look like. This Medicare summary notice is sent to people who have original Medicare. It's not a bill. It just makes sure that you know what's being billed to Medicare for you. You can call your doctor's office if you see something that doesn't seem appropriate. Maybe it was coded wrong. Maybe they need to fix something. Maybe they need to resubmit the claim if it's denied because it should have been paid for. Your appeal rights, if you believe that something's being charged for you or denied that should be covered, it gives you information about what your rights are to appeal that decision on these notices. And then step three, report. Report if you think you were a subject of fraud. Maybe you took a phone call and gave out some protected information and then you hung up and you're like, oh man, that doesn't feel right. I don't think I should have done that. I don't really know who I was talking to. Call someone. The Wisconsin Senior Medicare Patrol would be a great person to call in that situation. Or maybe you were trying to get something fixed and you're trying to get something that should have been covered, paid for, and it's just not working. Or maybe you think that someone charged you for things fraudulently. The Senior Medicare Patrol can help with that. All right, so we're kind of getting to the tail end here. I just wanted to take, a moment to go over everything we talked about because we covered a lot. It's pretty common that people will come in, you've gotten some questions answered, but maybe it's triggered new ones. So let's just recap a little bit about your coverage options. So remember, we're choosing between original Medicare and an Advantage plan when we're in Medicare. Original Medicare is that federal benefit. It's going to include your hospital coverage, your medical coverage. You need something that's separate for drug coverage, and that optional Medigap policy to help with your coinsurance costs. You can use it anywhere across the US, super flexible. If you're paying the premiums for your original Medicare and your supplement, it really helps limit what you're going to get from provider billing. Those policies are taking care of majority of that for you. Not the on the alternative version, a Medicare Advantage plan replaces that, also known as Part C. So these are the private-based companies that have contracts with Medicare, and they're your alternative to original Medicare, and they kind of bundle everything together. You can't have a supplement plan with these plans, so you're going to pay as you go. You're going to pay when I go to the doctor. I'm going to pay when I use when I need lab tests or exams. Everything's a separate charge, so you kind of pay as you use it in this version of Medicare. And a lot of plans with a lot of different options, lots of different networking. You got to use doctors in your network to avoid incurring costs unpaid. And they offer some of the extra benefits that original Medicare doesn't cover it. So, really encourage people to just really understand these differences, talk to other people, look at your own specifics, not just what your neighbor said was a good thing to do. You really got to understand this so you're in a plan that's going to work for you. You need to do that homework. And you're not alone. So this last slide is just kind of covering the fact that you have a lot of opportunities to learn, a lot of sites, Medicare.gov, our commissioner's office, you have our SHIP resources, and then locally here at the ADRC, you have our benefit specialists and SHIP counselors. We have very fortunate to have a nice small group of SHIP counselor volunteers. So we offer a lot of education. We do monthly classes like this one, Welcome to Medicare. We do Medicare Minute, which are very brief topics meant to be a very short conversation, but specific to how Medicare covers something in particular. Just to enhance your knowledge of how Medicare should work so you're informed about your benefits. And then we do one-on-one counseling just to help, explain what your particular coverage choices are, showing you that Medicare.gov system, helping you explore plans, again, in a very unbiased way. So we can't give you recommendations or suggestions on what to do. We're just helping you understand the material. So I hope this was very helpful for you today. Please reach out if you have further questions. And thanks for watching. Welcome to Medicare.